Whenever anybody you suspect has a psychiatric illness, gently go and share that with the person and say that just as you treat malaria, typhoid, diabetes and hypertension, you need to treat this early. Just as we treat hypertension and diabetes early, the recovery is faster. Similarly, any psychiatric illness, when you treat them early, the recovery is much faster. Mental health is always misunderstood in the country. Anybody in India has an opinion on the mind, just as he has an opinion on the cricket match. Just like every Indian knows what Harbhajan Singh should do. Similarly, every person knows why somebody is ill, what are the causes, what should he be doing. And there are so many myths. Many Indians feel that mental illness is because of witchcraft. It is because of the fact that gods are very angry with the person. It may be because of sins of the past and even the past birth. The mind is all about the brain and its connections with different organs and different glands which secrete hormones. When this orchestra gets disturbed, the basic emotions go haywire, like fear, anger, envy, love, sadness, and joy. But Indians are interested in knowing what is the root cause. When there is an emergency, when somebody says he wants to kill somebody or kill himself, there is no point in looking at the root cause. Just like an orthopedic surgeon looks at an X-ray of a fracture and says that the bones are broken, I need to bring it together, without knowing why the bones are broken. That is very important. Take the person to a safe place, seek an opinion, find out if the person is lethal to himself or to somebody else, and immediately start treatment. After which we can gently ask how this was triggered. When somebody asks a patient to go to a psychiatrist, he or she may not be popular, but he might save a life. If somebody talks about death and dying, a mental health checkup is a must, and in that checkup, the psychiatrist or the psychologist will test whether the lethality of the thought, the intention of the thought, is it mild, moderate or severe? Is it fracture of the mind, that is a psychiatric illness, or a sprain of the mind, that is just stress? He or she will differentiate between a sprain and a fracture. A sprain might get well with love, affection, holiday, playing, massage, or a break from work. But a fracture needs to be corrected by a psychiatrist and or a psychologist, which could need medications and counseling.